Hello, this is Dr. Ned Hallowell coming to you from my dining room in Arlington, Massachusetts. In the previous posting, I talked about how ADHD can occur in very high-achieving individuals, and I cited Bubba Watson at the Masters, which is going on right now, and Jaime Diaz talking about him on the Golf Channel. And my hope that someday he and I will meet so I can talk to him about ADHD. And the fact that a lot of very high-achieving people who have ADHD do not consult with anyone. And how unfortunate that is, because no matter how high-achieving you are, you still can benefit from the kinds of tips and ideas folks like me have to offer. So now in this follow-up, I'd like to give you some thoughts about what are the reasons to come see someone like me, and what do we have to offer. The primary reason is that you, no matter how well you're doing, you have a feeling that you could be doing better. What I call unexplained underachievement. Now, you could be doing incredibly well, and yet you know you could be doing better. And often it's inconsistent performance. You're doing really well most of the time, but then you have moments where you just dip for reasons you don't understand. As I say, unexplained inconsistency. It's not because you had too much to drink the night before. It's not because you didn't get enough sleep. It's not because you had jet lag or some obvious reason. It's for reasons you can't explain. I just lost it. I just was off my game. I just had a down day. On the golf course, I just pulled that shot. I mean, you know, but if these recurring patterns of inconsistency that you don't know how to explain. You blow up in a board meeting. You lose it with an employee. You on the set. You just don't know how to get it together and act your scene. That's common in ADD. And instead of just saying, "I guess I need more discipline. I guess this is just the downside of being me," that's where you might want to come to see somebody like me. Because this is the essence of ADHD. Lots of creativity, but inconsistency. Brilliance, but then inconsistency. And what I would do with you is take a really careful history and go over these patterns and try to understand them. It all begins with education. It all begins with taking a careful look at who you are. Most people with ADD have never done that. Most people with ADD are in such a hurry. Remember the race car brain with the bicycle brakes. Most people with ADD are in such a hurry that they don't stop long enough to understand who they are. And they don't look in the mirror. They're not good self-observers. So even if they do try to look at themselves, they don't look at themselves accurately. And they don't take self-reflection. They don't take others' observations and use them very well. So if they were to come to me, I would slow them down enough, if they're willing. You know, they have to be willing. But I'm pretty good at helping them do that. I'd slow them down enough to gather some snapshots. And I usually want to do that with another person present, with someone else who knows them well. A spouse, a partner, a colleague, somebody else who knows them well. Again, because they're not good self-observers. So what we try to do together is draw a picture over time of who this person is, who this person has been, and who this person wants to become. And that's a very important starting point. And then based upon that, we'd fill in a plan for how to achieve that. And that may involve coaching. In fact, it almost always does involve coaching. Strategic moves we can make, plans, in your day, how you could operate differently, reminder systems, cues that you could avoid or cues that you could anticipate. Sometimes it would involve nutritional changes we'd make. Sometimes it would involve physical exercise that we'd use. Physical exercise is tonic for your brain. Almost always it would involve breathing exercises and meditation. Sometimes it would involve medication, which can be absolutely miraculous when it's used properly. It's never necessary, but it can be amazing when it's used effectively. So we develop a comprehensive treatment plan, multimodal, and again, we would do that over time, and it would include frequent check-in points for follow-up, because you always do better if you get follow-up, if you stay, on top of the progress you're making. I don't never want to say 100%, but it's 99.9% sure you will make progress. That's one of the great things about this condition. Virtually always, once you get started on a plan, you do make progress. How much progress? That does vary, but it's almost for sure you will make progress. It's one of the reasons I love my job. I see people laying claim to a better life, no matter how good their life is when they get started. Give it some thought, and no matter how well you're doing, consider the fact that you could be doing even better. This is Dr. Hallowell wishing you a wonderful day.